Even better, if you want to turn it, that's
Like
fine.
what? Like this?
Yeah, and meaning I get something right there. Right there, sweetheart.
I pin you though. Let me see. No, it's not good enough. The other way's better.
Okay, do it the other way
Do
then,
it the
baby.
other. This is much better. See?
Okay.
You hold your.
Hello, everyone. Look at me. I look terrible. I need to have my hair washed. Greetings to all of you. Honey, you gotta turn it the other way. Stand it up like it is, but on this end.
On what end? Oh, the other end?
Yeah, because of how it looks.
Sure.
Okay, now.
That's you.
Yeah. Hi, everybody. I just wanted to update you. This is a post-operative update. I just came from surgery. Well, actually, I came from surgery a couple hours ago. It was a success. They they put pins in my wrist, and they, because it's broken,
Come.
and they,
Hello.
hi.
Miss Mack, I have your nurse here that's gonna be taking over for me.
Hi, I'm Jeanette.
Hi,
Are
Jeanette.
you okay if we go over your report and health history?
Sure.
Alright.
And here is.
She's live on here.
Okay,
If
that's
you don't want to be
fine.
on
Just
camera.
don't say your names.
Are you okay with me telling your health information?
You bet. I'm okay. But I'm going to show your face. Your voice will be heard.
That's
Just
fine.
don't say your names.
That's fine.
If that's what you wish, I don't care.
So this is Lupita. She's 57. She goes by Miss Mack. Full code. Transferred from H2 on 3/23. She came in on 3/22. No allergies. Done service primary. Ortho, nurse, flag consults. Ortho, neurosurge, PTOT, social work, and speech are consulted. Speech did come in and see her. She does have a concussion, but it's as expected. It's nothing to do. So bicycle versus motor vehicle accident, head lap with sutures is what she has on her forehead, and then make room for a lot of fractures. So I'll list the ones on the left side first. It's more extensive than the right. Left clavicle fracture. Left rib fracture 3 through 6. Left first toe fracture. Left radius fracture.
I have a broken toe,
It was reduced. That's what I was told in report.
so I have 5 breaks.
They said earlier.
It
you
was
didn't
a
have
right or my left, fam.
Left.
Because my right is the one I was thinking was. So my left toe.
Wow, your right toe's the one that's all
Is the
swollen.
one that's swollen
Black
and
and blue.
burnt. Are you sure?
Radius.
Listen.
They did the left wrist ORIF today. And then prior to that ORIF, it was reduced and splinted in the ED, I think.
I wish I could take this home, huh?
And then the left
Yes.
pneumothorax. They did place the chest tube, the left chest tube, they placed it yesterday. And then on the right side, it's ribs 1 through 3, better fracture. And then just other fractures is T5 infection. And bilateral knee contusion, so they're just straight up and generalized bruising. When they placed the chest tube on 3/23, she sustained a diaphragm tear. So she had surgery yesterday and they repaired
Wait a
that.
minute. My diaphragm was damaged?
That's why you were in surgery yesterday.
Oh, that was from the accident. Or was that from the surgery, the little thing they inserted, a perforation caused by that? Which one?
when they placed the chest tube, your diaphragm was nicked, so they had to go in and repair that. I don't know if they already had to do the surgery anyway.
They told me I had nothing, that they looked in the camera when they did the laparoscopic. I have the 3 little holes in the stomach. They said that I said, are you sure there's nothing that's being left unrepaired? Anything ruptured from the insertion of the thing? And they said, no, they never told me that.
Okay.
What is punctured again?
Nothing is anymore. Nothing was punctured. You had they repaired your diaphragm. It was diaphragm tear.
But probably from the insertion.
That's what I said. Yeah, from the
Oh,
insertion.
then somebody wasn't honest with me. I'm glad you're telling me. I kept asking over and over if the insertion of the tube made any. Ma'am, I'm still saying
Yep,
something.
I know. There's a lot that I have to go through,
Okay.
and I'm not even
All right.
halfway done. So
You got an hour. So.
No, I'm leaving.
Okay, baby.
They have a marijuana watch on for me downstairs. I love this hospital. There goes your phone, probably broken.
Oh,
That's my fault. You're live still. And it doesn't look cracked.
okay, honey.
All right, I'm just gonna have to work around this.
can you
Yeah,
turn
honey.
the camera so it's not?
Yeah, honey, do not have a face them. Only me. Sorry, people. We dropped.
I didn't mean that. Did I get them?
No,
trying to
you
get
didn't,
you-
baby.
Okay,
Um,
that's
sorry,
you.
people, that we dropped the phone. I will read the comments and respond, but I'm having to listen to reports.
I guess she's on 2 meters, but she's 91 on room air, so we just have her because of having coming out of surgery. But I'm sure she'll be fine on room air. I guess 2 liters right now. Q4 vitals, tally, normal sinus / sinus cap. She uses the bedpan, lifts her box, soft diet. Right, so her both IVs went bad, so I took them out and I stopped the fluids. And I didn't have time, this happened like within the last hour, so I would maybe take a look if you don't feel confident with anything, ask charge, and then I would probably, I'm already anticipating that we need to call it. Just because of like swelling.
Want any more Coke or anything?
No.
Anything else before
Yeah,
I
I
leave?
leave it all because I think I want a couple more bites.
Okay, well, that's when they come in, don't want to take it then.
Thank you,
You got a
sweetie pie.
channel changer in case you want to watch. You got your phone.
Yeah.
Here's this. I can't find that good
I want to hear the report, baby.
Yeah,
So with the new brace, it has to be custom because of the chest
two
tube.
here. I can't find the other one.
So they
Oh, wait. Oh, this-
are able
there's
to
your good
connect the Aspen color and the TLSO. But because it's connected, it's called the CTLSO.
Repeat that. I didn't hear. I'm sorry.
You're gonna get a collar for that goes around to support your back. when
Yes,
you get
ma'am.
up. Yes.
I have a broken thoracic 5.
Yeah, she does.
Yes, thank you.
Yeah, thanks.
The suction thing has been rinsed, so when she wants to
So
do it, it's ready.
TSO, answer with TSO brace, compensating for the.
I wish I could put your
And
flowers
then
somewhere
that's
nice and
for
nice
the
now.
T5,
Yeah.
but they're like, well, they call me that.
Oh, I know where to put them right there.
Be
I know
careful
where-
with the phone. Be careful with the phone.
Yep. But I'm already wearing this vertical collar. So they've already come up and seen her and taken measurements, so hopefully, I don't know how long it takes to custom. She has a free abdominal left side, for that. The A strap on her arm. Do you have feeling in your fingers yet? Can you
No.
feel them?
I
So
have
they did place a block.
I have no feeling in my left arm. I don't feel it at all. I feel like that's kind of foreign to my body not to have that feeling.
That's probably gonna break there.
She did get potassium phosphate, 500 mils.
Yes, I've been low on
That
potassium.
finished when she was in surgery. they were doing serial chest x-rays just to continue to monitor the pneumothorax. So this is connected to, it goes into the insertion site, which is all been drawn and packed and sealed. They did place wrap part of the tube with tape because it was leaking air somewhere in there. It has the foam tape wrapped around it. But it's good. Yeah, it's good now. Whatever's marked there is the top one that was from surgery, and then she hasn't had any output from it. So she's had a total of 10 minutes since she had the tear repaired yesterday, technically today. It was midnight. Okay. And then the arm, the wrist was repaired this evening. She
It really built up right here. Because you're
So
way over on
it's
it. You're
connected
falling
to
off the bed,
continuous
babe. This
suction,
leg is about off the bed.
I'm fine.
You need to do something about that
pressure.
before. Yeah.
Hold on, sweetie. I'm gonna
She's almost off the bed, ma'am. Her leg is on the edge here. Are you okay with that?
No, sweetie, I'm moving. I'm fine, baby.
Or use your muscle then?
So she has the sling for when she gets
Okay,
up.
sweetie.
She'll have this yellow silver brace when she
I wanna
gets
hear
up
the
with
report.
I'll
therapy.
do it.
She already has PTOT orders, so hopefully
What's PTOT?
therapy. It's therapy.
Thank you, ma'am. Yeah, the therapist, the speech was here.
The speech for the compression. I think that's basically it. She had 9:15 nails infused in surgery, and then she had that arm block, which is why she doesn't have any feeling yet to help with pain. She was just coming out of the surgery and coming out of anesthesia, just religious preoccupation and kind of loud, so they did give 2.5 of Valium IV to help with that.
Oh, I did have that one. Okay.
Yep, you were just a little worked up after coming out of surgery, I think. You were
Oh,
a little bit anxious.
I see.
Oh, you like these? For some reason, in this
Okay.
backpack of yours, in the inside slot.
Alright,
I can't
Is
find
that
it.
it, ma'am?
that's it. And Tom, it sounds like you're aware that we can have visitors up until 9 p.m.
Huh?
Okay, perfect.
Yeah.
So we
It's
shouldn't
gonna be
have
so
an
cold,
issue.
I probably won't be.
Alright, well, have a good night, you guys.
Thank you.
Thank you.
Thank you for the report.
Mrs. Lupita, how's your pain?
I'm Mrs. Vance.
Where is your social security card and your driver's license?
I told you that if you put the camera, sweetheart, when you're at home, I'll show you where.
I have to take pictures and send it to
Right.
Bernstein.
When you go home, we'll both get on camera
No.
and I'll show you.
You can't just tell me.
Honey, it's where all the papers are.
Where?
On the right, there are two with papers.
On top of your cubby hole or
On the
inside?
very bottom.
So pull open the drawers.
Yeah, the one on the right, and then I'll
Okay.
show you after that. Ma'am, honey,
All right,
you
you talk.
listen to
I'm
this.
sorry.
What were you saying, ma'am?
I asked what your pain level was.
My pain level is right now about a 7.
Okay,
It was about a 9.
okay.
And I don't feel the arm, but when I do, anything hurts my left because of the 2 surgeries I had on my lung thing. So it really, when they did the hand, I took it so well. I was so happy and I thought it would be like that. But no, now the pain is so unbearable.
All right, I think you are due for some pain medication, so I'm gonna grab that and then we're gonna check your blood pressure and everything.
Thank you.
So I'll be back.
Thank you.
yes,
What's your name again, ma'am?
Jeanette.
Jeanette, maybe we can wait on the pain. When was the last time I had a pain? Be
You
careful
did
with the
oxycodone.
phone,
Oh, I'm sorry. You had oxycodone. The last time you did
Sweetheart,
the blood, it was a couple hours, few hours.
how long ago did I have last pain med, please?
Shoot, that's as close as I'm gonna get it by you, honey. I gotta go there. See, there's your place.
Okay, thank you.
Some people in Australia that they have somebody who can talk to you.
Yes.
I can't do anything with this.
I think it was 2 hours, probably.
So everything's
More
kind of
than
been
that.
on hold until you got back
Yeah.
from surgery. Looks like you had allotted at 11:30 this morning, but you had some pain management. You had the nerve block while in OR. Looks like everything was put on hold until about 4:30.
Okay, so I had some more pain.
You have
med-
some medication I can give you. Correct.
Okay,
You're
I'll
good.
take it.
You have actually. She did give you. It looks like at 5:45. You got your
Oxy,
Oxy.
right.
Yep.
Oh, so then when is my next pain med due?
Dilaudid is what you can have next.
At what time?
Anytime. Almost there.
Then you know what? Let's do it in about 30 minutes maybe.
Okay.
When this starts to wear, I'm gonna really,
yeah.
really be hurting. And right now it's still bearable.
Okay.
So let's wait a little bit, may we?
Okay.
Thank you,
I'll
ma'am.
come
Like
back
she
around
said
then.
though, Ma, when you need it, you can have
Yes,
it.
sweetheart.
Only the Oxy's on time.
Yeah, but honey, I don't want this to be,
I understand.
that I cannot have any more med and this is killing
Oxy's
me.
every 4 hours. You had at 5:45.
Okay,
9:45 would be the next for that. The Dilaudid. I need to scroll back up there.
yes, please.
Dilaudid is every 3 hours.
Oh,
And I
it's-
had it at what time?
You haven't had it since before surgery.
Right. So
Oh, so I
4
could
hours
actually have
later.
it now.
Correct.
you could have got one an hour ago, is what she's saying.
Right. So then, because I do have 2 of them that I could have, I will take one. Which one should I have? Let me think.
But Dilaudid I can give you now, but the Oxy I can't give you until 9:45.
I see. I'll take the Dilaudid.
Okay.
Thank you,
I gotta
ma'am.
go to the bedroom and get everything loaded, and I'll be back.
Yes, ma'am. Thank you so much.
Kiss me.
Okay, sweetheart. Bye,
I don't
lover.
know what time I'm gonna get here tomorrow.
Okay,
It's gonna be
whenever.
39 degrees in the morning. The warmest part of the day is gonna be 52.
Don't even come if you don't.
If
If
I
you're too
can't, I
cold.
can't. If I can get
Right,
it right
baby.
here, I'll get it right here. I'll get Mark to pick me up after work and we'll visit for at least a couple hours.
Okay,
Because
sweetheart.
it's gonna be rain, everything. And the only nice days are gonna be Tuesday and Wednesday, and this is only Tuesday or Wednesday. So for the next week, it's rain and cold, and I'm on that moped, and you're not on your bike, thank God.
Right.
You're never riding a bike again. You'll never drive a car again because I'll be your chauffeur anywhere.
Right.
If we get my $1,400 settlement, I wanted to get a bike, but looks like I'm gonna have to get a car.
Really?
Yeah, I gotta drive you. You can't go. If you do, well, I think you're done with everything, man. You're done with everything. Hear me? For a good 3 to 6 months, how are we gonna pay rent?
Right.
We're in big trouble.
I got enough for rent for a few months.
I know what you're good, but that's not good. We need that.
Okay, sweetie, I'm gonna attend to my life.
Yeah, take care of your life. And we'll figure out how we're gonna pay rent.
And I'm gonna answer some of the comments. They've been very patient, all my dear souls. They've been very patient, so I'm gonna try now to attend to them a little bit, pay them some attention. So here we go. I have 10 people and 14 likes. Thank you, everyone. Hello, dear people. As soon as I went live, I'm a very busy woman, a woman who can only move part of her right side, is extremely busy, if you can believe that. I only move my right hand and right foot and my head a little bit like this and my eyes like this, and yet I'm so busy. They don't leave me alone because they're always doing something for me.
2
But
o'clock emergency surgeries,
I-
not one, but 2. They do one surgery, just have to do another one to fix what they did the first time at 2 in the morning. She comes out at 5:30. I come back here at 1 to visit her. She has more surgeries between 1 and 12 and 2. She didn't come out till 4:45. Wow.
and I had never in my life had surgery, people.
Never been in the hospital for a minute.
Never been sick or injured until now.
I gotta go. Kiss me.
Bye.
I love you so much.
I love you.
I'm sorry they won't let me stay here.
I
They say
know.
you should be in ICU still. You're still in crisis.
Sweetheart,
I don't understand.
just relax, my baby.
All right, I love you. I got to go.
I love you. You leave. You be careful, my baby.
All right, babe.
Drive carefully.
All right, mama.
Okay, sweetheart. So anyway, people, a person so busy like me, who only has very limited use of my body, they will not leave me alone because they're constantly doing something for me. which I appreciate very much, that they're taking such good care of me. They have been so good, people. And I appreciate you too, that you've been here for me.
See what I got?
So good, honey. So I'm sorry, people. Um, I was telling you that I just found out that I had a perforated diaphragm, which they had not told me. I kept asking over and over.
And broken toes, they didn't tell you about.
They didn't tell me about the broken toe. I asked because one toe was hurting, but it was the right one. They're saying that the left one is very broken.
Bye-bye.
Love you. Bye.
I'll call you later.
Okay, sweetheart. Let me concentrate on this. Okay, I have poor concentration. Bye, baby.
Bye-bye.
Anyway, people, I had a perforated diaphragm from the procedure. They perforated it and repaired it. They saw it by doing a laparoscopic surgery with a camera, and they saw it, they repaired it, but I asked over and over, and I think that's pretty bad that they didn't tell me. They didn't tell me that they had perforated it. Because I kept asking, is there any damage from the insertion? They said no. And it turns out it was. I heard a report just now. So then I got out of surgery. I went probably a 3 or 4. And now I am just concentrating on recuperating. I am in lots of pain, people. My left arm, I have absolutely no feeling or use because they blocked the nerves in order to do the surgery. This is so extremely painful that they had to block the nerves. So they're blocked for probably another hour. And when they're not blocked anymore, people, my pain is gonna make me scream. It'll be probably past a 10. It'll probably be an 11, 12 pain. It's probably gonna be the worst pain of my life. And I'm bracing myself for it. So I just wanted to update you. Thank you for being here. I appreciate your help. And I hope you all have a great night. There are more things to talk about. But look, somebody else came. I'm extremely busy, as I told you. So I'll keep you posted and updated some other time. I did not get to read the comments. So I'll stay on a little bit longer. When she gives me my painkiller, I'll respond to some of the comments and some of the greetings and questions. So bear with me, people. I'm trying not to video the people. Bear with me if you would. So thank you for being here. You are very dear to me, dear selves, dear souls. So do I have my pain?
I have to take your blood pressure and everything first, so relax your arm for me.
Sure, hold on, sweetie. I don't want this blocked. All right, people, they're taking my vitals, and then they'll give me painkiller, and then I'll probably start screaming after the nerve blocker on my surgery arm wears off. But I have to live through it.
That's all right. I just wanted to see if you wanted to do a report, but I'll catch up with you when I get out of 20. Is that right? Okay, it'll be a few minutes and then we'll catch up and get it. Okay. gonna take a full look at you and then I got your pain medicine, okay?
Okay.
Turn the light on.
Alrighty, and then I'll just, after that, continue with my live so I can hear I can see what the people are asking or commenting.
Can you feel me touch you? Do you feel
No,
pressure at all?
not at all. That arm is non-existent right now.
Okay. Can you feel here?
There a little bit.
How about here?
Uh-huh.
Okay. But not my fingertips. Your fingertips.
Nope.
Okay. Everything kind of hurts, huh?
Yeah, everything.
And your pain level you said was an 8?
About a 7.
7? Okay.
Yeah.
I want to look at the chest tube insertion site, so I'm gonna do
My
the
arm.
best look I can.
Can you first uncover me, my dear? Okay, are you able to access it?
Yep.
And that's the insertion site?
Yep. I'm just looking for swelling, feeling for crepitus. That's crunchiness.
Yes. I have a lot of crepitus on my chest.
You feel it when you breathe?
A lot. And they said it was because of the air pockets between my lungs and my muscle. And that's why they did the insertion. And it has alleviated some because I could hardly breathe. And they said for 2 days he would feel that way.
I'm just listening to your heart to start with.
Mm-hmm.
All right, take some deep breaths for me. And keep going the best you can. And then reach over here.
I am covered, right?
Yeah. I'm just gonna listen to your belly.
Okay.
You had a bowel movement yesterday?
No bowel movement.
Okay.
No gas until 2 hours ago.
Okay, you are passing gas.
Yeah.
Okay.
I had nothing like that until 2 hours
And
ago.
you urinated today?
Very well yesterday and today.
Okay. After surgery, have you urinated?
Sorry?
Have you urinated since surgery?
Twice.
And you've eaten?
Yeah.
All right. No
Delicious
nausea, no
food.
throwing up?
No throwing up, no nausea, no. No nausea or vomiting after the meal, which I'm surprised, happily surprised, because I've been vomiting
Push
and
against me.
very nauseated.
Are you nauseous now?
No, I have been,
Toes to your nose.
and now I don't feel anything. Toast to my nose.
Yep. All right, once I give you some pain medicine, we're going to reposition you a little bit.
Okay, and then we're done
We're done for a little while.
for about 5 minutes, huh? And then back to being the busiest woman around.
Well, remember what we have to do is start an IV.
Oh, that's right. So maybe I should just cancel this. Close it up. Unless they want to just stay, I don't mind. If you people want to stay, I haven't gotten to your comment. But if you want to stay, I don't mind that you know my history. I want you to know me. I want you to know more about me. And I don't mind about the medical history that some people want to keep very private. I don't mind that you know I'm usually healthy. I've always been healthy all my life, other than this accident. I've always been extremely healthy. I thank God for that. And I don't mind if you know about me at all. In fact, I like it. I think it creates a bond between my subscribers and me. So thank you, everyone. Oh, I have so many likes. Thank you, my dear people.
I gotta take some tape off and look for what we have open.
Okay. Oh,
I know you can't feel this, but it's still picking up your pulse. So we're gonna
yes,
put that here.
ma'am. Yes. So you're gonna change the IV?
You have to put one in.
Do you want my hand up there? Should I move my phone?
Actually, I'm looking at where my approach is gonna start from.
Maybe you can put another pillow here. I'm just trying to help find ideas so that,
Like
Oh.
you had your IV right here at one point.
I think so, yes, ma'am.
Sorry, just the tape.
No, you're fine.
Whoa, they got it wrapped up.
Yeah.
Nice, Sonia.
Ah.
Okay, sorry.
No, you're fine, my dear. If every problem could be solved that easily, are you kidding? Put up with a tiny pain like this and the problem is gone? Yeah, I would take it all the time. This is easy. The easier part.
It looks like I have a place to start an IV here.
All right. And I may not get to my son's comments, but that's fine. I just want you to know, people, that you're very important to me, whether I have one of you present or many, whether it's 1 or 100 or 1,000 or whatever. I just love having you around. It means so much to me to feel that I'm not alone, because being alone is so hard, people. So hard.
Oh, thanks.
You know what, my dear?
What's up?
If you don't mind, I'll put the phone here so that they can see the subs.
Well, I have a sterile area right here, so you can't move this arm.
Oh, can I move it? Oh,
No, you can't move that other one right now.
no. Can you put it down?
I have sterile hands, clean hands also.
I see. Can I grab it?
This is all sterile and clean process. And you have a tourniquet on. And I don't have much time before I would have to take it off.
Okay.
The vessel I was looking for doesn't look like it's gonna keep itself shown up.
I have very small veins,
Yeah,
difficult ones, my dear.
I can see.
Oh,
I'm-
now can I grab the
You
phone?
can move your phone, yep.
And then that way they can hopefully see.
I have to move this so I'm gonna look lower on your arm.
Oh, so I'm not able to hold it then? That way they can see?
Let's see what kind of access point I see here.
Okay. And now we'll put it back up. I just wanted them to see. That's all they're seeing is a face and a mouth talking. So I wanted them to see what it's getting done, if possible. I want to share as much as I can of my life with them, with my subs. I don't mind. Even the trolls, I don't mind. Sometimes they can be hard to bear, but I don't mind. I love people.
So I'm gonna have you put your hand flat if you can. I know it's gonna be.
Oh, and hold it like this?
Yep.
All right.
Because your hand flat is gonna be something that we need. There we go. You poke.
Ah, yeah. And it's okay. Like I said, if everything in life were like that, difficult, don't we? You believe you got it?
I believe I got it.
Thank you for letting me do this and show them. Thank you, ma'am. Yeah.
If it stays good, here we get a little bump. I'm gonna wash, but it's a good flusher.
I hope that they can see.
We might be needing to take your wristband off,
Oh,
placing it
on the other
maybe
side.
somewhere else.
Okay, let's do that if we have to.
I think we'll be good for now. I can give you your pain medicine.
Okay,
So that goal is accomplished.
yeah.
I'm leaving this here because the next thing I'm going to attach is your pain medicine.
Okay, doke. Sounds good. You were very good because I have very small, tiny veins, like little threads, and you were able to get it and retain it. Thank you.
Hopefully we got one that lasts.
Yeah, well, if not, what can we do? Change it.
Yep. I gotta come over here.
Yes, please. And I still have food. It was so good, I just couldn't eat it all, but I'm going to eat a little bit more.
So tell me about your pain. Ache, stab, burn, pinch, pull, what?
Say that again?
What kind of pain? Ache, stab, burn, pinch, pull, pressure?
I would say pressure on my chest. And what were the other choices?
Pinch, pull, stab.
Stab on also on my chest a little lower. Stab real bad to where I'm thinking, is something punctured? So that's my Dilaudid.
Yeah, 1 milligram.
Okay. Maybe we should put the phone down so I don't have to, because that's gonna hurt. I don't have to drop it. Yes, right there. Then I hold my arm up. Can you put another pillow, ma'am?
I don't
Or
see any more in here.
Fold this one, would you please? Fold that one.
There's not a pillow.
Oh. Oh, I had a whole bunch.
I think they're all
If I
under
have one
you.
on my head, I don't need one on my head. They told me I should not have one, so take it out, would you? I don't know if you put it there, probably in surgery. Yes, ma'am.
Goes in over a couple minutes, so
Yes. And that hurts.
stings. Where did your accident happen?
Off, not too far from Division, like Franklin and Lafayette, because Lafayette runs like Division, parallel. I had moved from Division to the next one because it's not as busy. But actually, usually I go division to Cherry and turn right. My work is right there, right here by the hospital. And on Cherry. And I said I'm gonna turn a little bit earlier, less traffic. I was on a new bike that I needed to still learn a little bit about. And I saw a car behind me. So I thought, since bicycles always stay to the right, I thought maybe he wanted to turn right or whatever. When I looked, I always, for some reason, on my bike, I always, when I turn and look back behind me from my right side, usually. And then I always look at my left. Most people just look at their left. For some reason, I always have this urge to look at the right. So I saw him. I thought maybe he wanted to turn right. And I thought, I'll get out of the way. Why is he so close? But everything happens in a second, just a second, one split second decision. So I sped up to my left to get out of his way. He sped up behind me, hit me, and stopped.
He
He
didn't
was-
stop. Whoops.
Yes,
Well, that's good. He stopped.
yes.
Here's his back.
Just stick with that.
Okay.
I don't think you should do it on the napkin. And no, you need to fold.
But I have a lot of things in my hand.
Oh, that's right. So then leave
Here,
it
look.
right here.
Why don't you hold on to it until
I'll
I can
hold
take
on.
care of it?
Yes, ma'am. Sorry, people. And so, anyway, I went left. He sped up, and I thought either one of three things. I thought he's either confused because drugs or drinking. It could be even medicine, But I thought either drugs play a role, or he wants to kill me, and I don't see how. He doesn't know me, but you never know. Or he wanted to go around me. But he sped up, and of course, a bicycle is not going to go faster than a car. So when he sped up, he hit me and he stopped. Had he not stopped, I would have died. Had he hit me from the back, I would be paralyzed if I survived. Because he hit me on the side, he broke ribs, clavicle, and he broke my wrist and my toe now I found out.
Right.
So toe, wrist, and now with the perforation of the surgery, my body has gone through a lot.
I'm gonna let that pain medicine kick in, and then
Uh-huh.
I'm gonna come in with probably my tech and get you repositioned. Okay?
Okay.
Do you have your call light?
No, I don't know where it is. And I'm just gonna answer some of these comments and look at them and say goodnight to my subscribers. And I'll see you in a little bit. Right, ma'am? I was saying I'll see you in a little bit. I'm getting sleepy from the med,
Yes.
and I'm gonna say goodnight to these people after I read the comments, and I'll see you in a little bit. Would you kindly turn the light off? They always forget.
Yep.
It's always in my eyes, and I do not like it. So I appreciate it, ma'am.
Your call light's on the bedside desk.
Yes, ma'am. And I thank
I'll
you.
be back.
Yes, ma'am. Thank you so very much.
You're welcome.
All right, people, I'm back with you. Sorry, but I just wanted you to witness and be part of my treatment. Okay, people. I'm going to answer some more of these. Peekaboo says who? Says Pugface. Oh, my dear Pugface, thank you for being here and for everything. People, life's not easy. Okay, what do I have here? I'm getting very, very sleepy from the drugs, my dear subscribers. Oh. Let's see. She got hit on the side. On the bike, e-bike, yes. Yes. If I had gotten hit on my back, I probably would be paralyzed if alive. All right, people, I'm getting sleepy. I'm sorry. So what else are you saying, dear subs? Fancy and Lodge, thank you for being here. And you're saying another surgery behind you. So that's good. Yes, it is, dear. My dear brother. What happened? Well, I already explained, El SoCal, that the car came behind me, sped up, followed me, hit me, and stopped. When we both veered to the left. And what else? Another surgery. I've had 3 surgeries, and I guess if you count the repair of what the puncture on my diaphragm, that's 5 surgeries then. I don't know. Many. Hey y'all, says Bugface. I'm so sleepy, people. I can hardly keep my eyes open. But I'll keep reading and being with you as long as you don't mind. I love you guys so much. I really wish I could get to know you, each one of you personally. But I'm just blessed to have you. Okay, let's see what Puckface is saying. The accident was yesterday, yes. Monday at about 2 p.m. because I had to be at work at 2:25. Rolling 20s, there you be. Oh, thank you that you called me on the phone. That meant so much to me that you dialed me. You were the first one to dial me. Several others have dialed me on the phone. And if I can get to more before my eyes close. She's gonna be a rich person. Rolling 20s, the way things always go for me. I don't really know, and that's not what I aspire. I want health, and if I do get any money, I want it to be a blessing for others. Money in the hands of believers in Jesus Christ is always a blessing. So that's what I want it to be. If money comes to my hands, it will be a blessing. God help me. Thanks, Ben, says El SoCal. What a great man to be by your side. Yes, yes, my dear. Yes, I thank God for my husband helping me. I'm his caregiver. He's so sick and he's taking care of me. I thank God for him. Thank you. I am so tired, people. I can hardly keep my eyes open. So let's see what else. Tommy's taking good care of her. Yes, he is, Benson, a lot. You have a way to get a hold of us. Call us anytime, sir. Hope you recover soon. Yes, thank you. Thank you, El SoCal. Alexander Mayer, Oh, there he is. Oh, God bless you, sir. Please know that I often think of you. Yes, a lot of surgery. Thank you, Bob Bitchin. Hey, hey. All right, people, I think that's it. I'm gonna say goodnight. I don't know if there are any new people, but I can barely talk now. So I hope you all have a good night. Many blessings and much love. I have to go or I'm gonna drop this phone. See you. Oh, I miss any of these comments, Lord. Desert God, I'll be calling you, sweetheart.
Hi, Miss Matt.
Hi.
How are you?
Lots of pain, my dear. How are you?
I'm good, thank you. I just came in changing Sally battery.
Okay, yes, my dear. I ate well after not eating for about 2 days or so,
Oh, that's good.
and it was delicious veggie meal. I'm returning to vegetarianism. I quit about 7, 10 years ago, but now I'm going back to vegetarianism.
Okay.
And I just put live, so if you don't want to see your face,
Oh, okay.
we don't have to at all.
Okay.
But I do want them to know what's going on. I fell asleep a little bit because I got sleeping pill.
Okay.
No, not sleeping pill, pain pill.
You get your pain pills?
Yes, ma'am. And it
Good.
really helps. Otherwise, I'd be screaming because it is terrible pain. May I get a tissue, please? Or even this, a washcloth, anything to wipe my nose.
Yeah. Tissue should be.
I hope it's not blood because I've had a little bit of blood coming out of my throat and nose. But something is wet. I don't know what it is. Thank you, ma'am.
You're welcome.
And you are who?
I'm Kiara. I'm sorry.
Kiara.
Yep.
Oh, I don't think I had you here before.
I think I had you like this morning for like a slight second.
I see. Yeah, no blood.
No, that's good.
Yeah. I'm on how many liters of oxygen, ma'am? I think it's 4.
Yeah, I think 4.
4.
3. 3.
3. I like that better
Yeah.
than 4. I don't want to have to be dependent on oxygen to breathe.
Yeah.
So what are we doing, ma'am?
I'm just changing your telly batteries.
Oh, good. And I'll be on telly the entire time, pretty much, until I go to Mary Free Bed.
I'm not sure. I'll have to ask your nurse. If you will be. She just told me that you were on telly today. So
Okay. You do know what telly means, right?
it's like monitoring your heart.
Telly is far,
Huh?
like telephone, that's far.
Yeah.
So television, you can see from far because it's not happening here. It may be happening many miles. So
Yeah.
telephone, television, and telemetry, you're measuring or monitoring my heart
Yep.
from a distance.
Yep.
That's what telling means. And when people sometimes say, when I wish you could smell this food I'm cooking, they're saying on TV, the cooks.
Yeah.
Some cooks will say, I wish you could smell it and we could have telly smell. That's not it.
Yeah.
It should be smell. It should be, let's see, telly smell. Should be, telly's far. So it should be, I can't think clearly. It should be, television. It should be telesmell. Telesmell, it should be. And they say smell-o-vision.
Oh.
But you can't,
Yeah.
telly's far. The only thing that should change is the phony sound, obviously, phonics,
Yeah.
vision. So if they want you to smell, if they wish you to smell what they're cooking, they should say telly smell, but they always say smell-o-vision, which is incorrect. Anyway,
Are you done with your tray?
no ma'am, I want to keep eating.
You wanna keep? Okay.
I just had the med and I think I might have been snoring in front of my subs,
No,
my
you're fine.
subscribers.
Yeah, you're fine.
So what are we doing now? I'm sorry, you told me, but I forgot.
Oh, I just changed your telly batteries. That's
And
it.
that's it?
Yep.
All right, ma'am.
Is this okay for you?
Yes, ma'am.
Are you
Everything is
comfortable?
great. You've been wonderful.
Thank you.
And I want to I hadn't thanked you yet because I hadn't seen you. So thank you for all your wonderful service.
Thank you.
Appreciate it.
Let me know if you need anything.
Yes, ma'am. I will call you. Thank you.
You're welcome.
I got how many of you, dear subs? I've got 4. Thank you. I was sleeping. Thank you for being here with me. Someone asked me, did you see the person? No, Alexander Mayer. I did not see the driver, male, female, black, white, old or young. I could not tell. I was unable to see. And I'm just reading the comments for conversation. Deb, I want to make you a sub, Deb. It says, Deb says, makes sure they move you, not to get bad sores. Yes, sir. Yes, ma'am. Seb, I think that's a male. I apologize. I don't know what her name is. Yes, and the breathing too, my dear. The breathing, I'm making sure that they keep me breathing. And the bed sores, I'm able to move myself. My husband helps a lot too. So I think that's it. If you guys want me to let you go, I've been on over an hour. It's so precious to me that you're all here. Yes, Alexander Mayer, the person driving sped up, hit me, and stopped. I don't know what that was about. Either they wanted to kill me, which I don't think so. I don't know the one thing. And or they were on drugs maybe, or under the influence of alcohol, and they sped up, hit me, and stopped. I don't understand. Maybe they wanted to go around me, and then they hit me and stopped. I don't know. So let's see what else people are saying. I love that I fell asleep, people, with you here with me. That was very special. I didn't realize I fell asleep. Someone saying that I look better than I looked yesterday. I was worried yesterday. Yes, punk face. I'm in bad shape. But I am conscious and I'm not going to be paralyzed. And I'm very thankful to God for that. I've had very little confusion, most of it induced by the medications. So not by injury, even though I did hit my head. I have stitches right there above my eye. I have like 11 or I don't know how many stitches there. And today I hope that tonight they'll wash my hair. So I have stitches there and they put one here on this side. The rest can, I think, be washed by now. And my head, the back of my head is very sore. Very sore. Morphine makes it all better. I don't think they put me on morphine. Yes, Pugface makes you very sleepy. My husband was on morphine for about a year or two a while back. Now they don't want to give it because of the epidemic of opioids. So get well soon and gotta get back to work, says Pugface. Thank you, my dear. Each one of you. I wish I could see you and hug you. Please get virtual hugs. You're very dear to me, everybody. Thank you, El SoCal, that I'm always good to everyone. Thank you, sir. I just love you. I love you. I love people. The same God that made you made me. He loves us all. And he is love. So how can you not love people? Let's see. I think I'm almost done with the comments. Mr. Mac, does she have a PayPal? You know what, my dear? I think a couple people have asked. I tried to do Cash App. I do not know how to work any of that. I would like to. So maybe I'll work on that a little harder till I get it. I have to be persistent. I will, Pugface. I know nothing about that. I've never been monetized in any way. Thank you, sir, for asking, Pugface. Well, people, sorry. For a change, I've been pretty good about having my camera steady, and now I'm only one-handed trying to operate it. Thank you. He says it is horrible seeing me in this condition, says Alexander Mayer. Thank you, sir. Thank you so much. Today, who's asking this? I wish I could move my left hand. Oh, I dropped my pillow. Oh my. Okay. It says, what does it say here? Sam, Pamsi says, did they catch the guy? Yes, he did not run away, people. He hit me and stopped. So he sped out behind me, hit me, and stopped. You sound better since Magami tea. Yes, Magami tea. I was so dry and they couldn't let me have any water because of having surgery. So my tongue was stuck to the roof of my mouth. So dry, but they couldn't give me anything. Now that I've had surgery, I just ate and it was pretty good. I ate veggie burger. I ate something I don't have very often, a malt, chocolate malt, and I ate soup, and that's about it. I got full fast after 2 days of not eating. Yes, I will keep the pain meds going, Megami tea. Oh, you precious desert goat. He says, busloads of people, bootlickers, couldn't stop Mrs. Mac getting hit by a car. Can't stop Mrs. Mac, little Mac. She's the greatest cop watcher in the world. I love you. Thank you. I don't think I deserve that title. Thank you for your love. That I will take anytime, every time. Thank you so much. People, I want to cry. I want to cry. I love you. And who's the last one? I think it's pretty close to closing, unless you want me to stay. It says, Upstate South Carolina News. Maybe that's what it says. I can't see. But it says, where could we donate? Yes, sir. I'm going to put a PayPal up or something. Don't know how to do it. Don't know computers. I wish one of you could maybe help me. If someone can help me, that would be great. Yes, good painkiller, my dear. I think this person, his name is, I can't see. Ed E. Good, good. Yes, all will be done live. I keep updating you because I want you to know what is going on. Oh, my chin. 1 second, please. My neck brace keeps going over my chin, which is not good. I do not know how to work this very well, my dear. Okay. All right. Chest tube is very painful. Yes, I've got 2 of them because one perforated my diaphragm, and then I found out that they had to do a third surgery to see if anything else was perforated. They did a laparoscopic through my stomach. So I never had surgery in my life. Oh, I take that back. I had tonsillectomy as a child. Otherwise, nothing until now. And this one says, Lady Zaga, thank you for being there. Lots of injuries, people. Yes, Lady Zaga. I'm very hurt. But I'll survive it. Alabama camera again. Prayers. Thank you for your prayers. Oh, I'm sorry, Eddie. It could have been worse. I saw the blood when I hit the car. I saw the blood fly from my body down to my purse and the ground. I saw that. A bunch of blood squirted from the face. I will, M Star Precious, my dear. I will get better. Yes, Desert God, I will call you, send you a text. Yes, my dear. All right. Okay, everybody. I suppose that's it. Let me look. I was here yesterday, at least. No, and left her stream going while I was working, goat. I have been laying low today, feeling, I'm so sorry, feeling low, checking in, says M Star. Oh, M Star. Oh, my dear. You be careful, you stay safe, and you take care of yourself. 99 says upstate South Carolina news. Yes, good night, everyone. I think that's it. I think that's it. I'm gonna eat a little bit more and go to bed because it's 9 o'clock here, people. Thank you for your prayers, upstate South Carolina news. I love you all. Thank you. Sleep, stream starting soon. Yes, I will sleep. Thank you. I think that's it. Much love, says Cup Locker. Yes, sir. Yes, ma'am. I think it's a male. Yes, sir. All right. Who is this person? Noel Armson. Thank you. I think I didn't pronounce it right, but I think you get my drift. Yes. All right, everybody. Good night. I got 3 of you left. Oh, and I still got comments. But someone's coming in. See how busy a woman I am? So, I'm going to cut it short, people. Love you all. Good night. Oh, Northern Corruption. Monitor 907. He 907 is thanking you all for coming to my live stream. I love you all. I could cry. I wish I could hug you all. I wish geography did not keep us our distance. Let me go. The ladies are here to do something. So I'll talk to you all later. I'm missing a lot of your comments, I guess. God bless you all too. Good night. I'm shutting it off. Here we go. Off.